Arthritis is wearing out of the joint cartilage, the cartilage that lines the joint, and it progressively wears out, causing pain and stiffness. There are different types of arthritis. The most common we see is osteoarthritis, or we call it age-related arthritis. This is the wear and tear of the joint cartilage over a period of time. There are different types of arthritis, like inflammatory arthritis, which you see in rheumatoid patients, gout, psoriasis, and there could be arthritis if you've had injury to your joints, like post-traumatic arthritis. These would be the most common causes. The risk with arthritis is that it's a painful, swollen joint, and it affects your mobility. And in terms, it can affect the function across the joint and the muscles across the joint, leading to wasting of muscles. And lack of exercise in general can have other health implications and mental health implications if you're in pain all the time. It can lead to depression. It can lead to irritability. Arthritis can be prevented. There are certain factors which would influence, even if you're programmed or if you've had a family history of arthritis, to prevent it. If you follow a healthy lifestyle, if you undertake regular exercises, keep your body weight within optimum limits for your height, so your joints are not working more than required, then you could prevent osteoarthritis. Keeping healthy diet, making sure you've got all healthy nutrients within your diet. If you have arthritis pain, I think first and foremost would be to follow a step ladder pattern to your painkillers, whether it's taking on and off painkillers or regular, starting with simpler painkillers and moving on to slightly stronger one very occasionally, anti-inflammatories. Your general practitioner or the specialist would be able to help you with this. The other way to manage it would be physiotherapy, so exercises across the joint to make your muscles strong enough to withstand the joint reaction forces and support and align your joint in a way that it reduces the impact on your joint. You can use walking aids, braces, and supports to help distribute the weight and support the joint. Massages, local topical anti-inflammatory creams can help as well. Long-term wearing out of joint cartilage can cause deformities across the joint, and it can cause, you might have seen people with bow legs or knock knees. That's secondary to arthritis, wearing out the joint cartilage in a particular part of the knee, stretching the ligaments across the joint. This can lead to stiffness of the joint, which means your muscles aren't functioning very well, so they can contract. These are the physical implications. It can reduce your activity, so you're not able to exercise your heart, your lungs, because you're not able to go for regular walks, runs. And as I indicated, it can have a mental health impact. If you're in pain all the time, taking painkillers, your family, friends might notice you're a bit more irritable than usual. You might feel depressed yourself if you can't do things that you would want to do. So overall, it has impact on every aspect of your life. In terms of surgical treatment, once the patients come to me and if they have exhausted their conservative or non-operative treatment, we would talk about surgical treatment. For knees, it would be either partial knee replacement or a total knee replacement. For hips, it will be total hip replacement. These are time-proven operations, providing greater patient satisfaction and pain relief for the patients, and excellent improvement in function. We can do it in a manual standard way, or we can do it in a modern robotic assisted joint replacement way. These are the options I would like to discuss with my patients. They have predictable results. The joint replacement designs are much better. I do specialist approach for my hip, which is not taking out the big muscles around the hip, going very small posterior approach through the hip, so that they don't limp, their balance is well maintained, their recovery is quite quick. I employ enhanced recovery protocol in my practice, which means the patients will be walking within a few hours of their operation, and hopefully they're home the day after. So it's a teamwork with physiotherapy, my anesthetist, and myself. These are the options I would discuss with my patients.